More than 1,000 people pass through this market every day. None of them had any idea that here, among fish stalls and cages of live animals, a new era of human civilization had already begun. Late 2019, the world is moving at 1,000 miles an hour. People are booking flights, planning Christmas holidays, closing deals. It is an ordinary time, one that nobody appreciates until it disappears forever. While millions of people around the world prepared to ring in the new year, analysts in Geneva were already reading an ominous report containing 3 words: of unknown origin. In January of 2020, the United States government received a warning. Intelligence officials saw it. Public health experts briefed the White House. A handful of senators quietly canceled overseas trips. And yet, America did nothing. What happened over the next 90 days would become the greatest institutional failure in modern American history. More deaths than Vietnam, more than Korea, more than the Gulf War, Iraq, and Afghanistan combined. This is not a story about a virus. This is a story about the silence that allowed it to win. December 2019, Wuhan, China, a transportation hub of 11 million people, larger than New York City. Factories, universities, highways, high-speed rail lines spreading in every direction like veins from a beating heart. In the emergency wards of Wuhan's central hospitals, doctors are beginning to notice something unusual. Patients presenting with severe pneumonia, but the usual treatments aren't working. The usual viruses aren't showing up on tests. One of those doctors, an ophthalmologist named Li Wenliang, sends a message to colleagues on December 30th, warning of a SARS-like illness spreading at the seafood market. Within hours, police appear at his door. He is forced to sign a document admitting to making false comments. He is told to stop disrupting social order. Dr. Li Wenliang returns to work. He contracts the virus from a patient. He dies on February 7, 2020. He was 33 years old. The mechanism that silenced Li Wenliang was not unique. It was systematic. Local officials in China understood that reporting a major epidemic upward through the Communist Party hierarchy risked their careers, or worse. So the data moved slowly. The warnings were softened, and the virus moved freely. On January 1, 2020, Chinese authorities closed the Wuhan seafood wholesale market, suspecting it was the source of the outbreak. But they told the public almost nothing. The WHO's China office issued a statement saying the situation was under control, that the governments of all countries should understand and support China's efforts, respect the professional advice of the WHO, and avoid overreaction. WHO's statement, January 2020, January 11th, 2020. The world reached its first grim milestone, the first officially recorded death from the novel coronavirus. A 61-year-old man, a frequent customer at the Wuhan market, severe pneumonia, respiratory failure. He would not be the last. By January 23rd, in a move unprecedented in modern public health history, China locked down the entire city of Wuhan. All outgoing flights and trains canceled, buses and subways and stopped. 11 million people, severed from the rest of the world. The images were haunting, but they were also, for most Americans, distant. A story from somewhere else, something that happened in places most people couldn't find on a map. That comfortable distance was about to collapse. January 20th, 2020. The first confirmed case of COVID-19 in the United States. A 35-year-old man in Snohomish County, Washington. He had returned from visiting family in Wuhan. The response from Washington was swift, or so it appeared. We have decided to take strong but necessary actions to protect the health and well-being of all Americans. We will be suspending all travel from China to the United States. President Donald Trump, January 31st, 2020. It sounded decisive, but the travel restrictions had enormous loopholes. They didn't apply to American citizens. They didn't apply to permanent residents or their immediate families. And most critically, they were pointed in entirely the wrong direction. While the cameras focused on passengers arriving from Asia, the virus was quietly entering the United States from Europe, from Italy, from the United Kingdom, from France and Spain, where it had been spreading undetected for weeks. Genomic tracing, the science of reading a virus's genetic mutations like a travel diary, would later reveal the truth. The outbreak that paralyzed New York City did not come from China. It came from Europe. The administration had locked the back door while the front door stood wide open. This doesn't make Americans safe at all. The epidemic here is just as bad, if not worse, than in most parts of Europe. This is a microbe. You just can't erect travel bans and expect that you're going to be safe. Infectious disease specialist, February 2020. And there was a second catastrophic failure quietly unfolding at the same time. One that wouldn't become fully understood until it was far too late. In early February, the CDC distributed its first diagnostic test kits to state laboratories across the country. Within days, the results came back. The kits were flawed. A contamination issue in one of the CDC's own labs had rendered the tests unreliable. State laboratories could not verify results. The country's early warning system, the only tool public health officials had to see where the virus was spreading, had just gone dark. For nearly 3 critical weeks, America could not test its own citizens. Public health officials were, in the words of one epidemiologist, flying completely blind. The virus did not wait for new test kits. While testing kits sat broken in laboratories, life in America continued as normal. Political rallies filled arenas. The NBA played its regular season. And in New Orleans, the annual Mardi Gras celebration drew hundreds of thousands of revelers into the streets, providing the invisible virus with perhaps its single most efficient transmission event in the entire country. New Orleans would pay a devastating price. The invisible enemy. In early February, a luxury cruise ship called the Diamond Princess was quarantined in the harbor of Yokohama, Japan. 3,700 passengers and crew trapped aboard. It became the most closely watched epidemiological event in the world. A floating laboratory that would reveal secrets about this virus that would change everything. And what scientists found was deeply alarming. By the time the quarantine ended, more than 700 people had been infected. Roughly 19% of everyone aboard. 14 people died. But the most critical discovery wasn't the death toll. It was what happened to those who didn't die, or rather, who never got sick at all. Between 50 and 75% of those who tested positive on the Diamond Princess showed no symptoms whatsoever. None. No fever, no cough, no shortness of breath. They felt completely fine, and they were contagious. The virus was invisible. It could move through a crowd, a subway car, a nursing home, carried by people who had no idea they were carrying it. This data was available to American public health officials in February, 6 weeks before New York City collapsed. On March 11, 2020, the World Health Organization officially declared a global pandemic. Within 48 hours, the United States government declared a national emergency. The word that had been unspeakable for months was suddenly everywhere. The American economy, the strongest in the world, ground to a halt in a matter of days. Unemployment claims surged by millions per week. Lines at food banks stretched around city blocks. The Treasury Department began printing and distributing relief checks on a scale not seen since World War II. But nowhere in America felt the weight of those weeks more than New York City. It's never been this demanding. More calls than 9/11. A couple days ago, it was 7,111 calls. That's more than we've ever had. New York City. First responder, March 2020. Hospitals overflowed. Doctors were forced to make decisions that no physician should ever have to make. Who gets the ventilator and who doesn't? Nurses reused N95 masks for days, then weeks. Personal protective equipment that was supposed to last for a single procedure was being stretched across entire shifts. I never thought in this country we would be put in a position where we have to decide who's going to live and who's going to die based on who's going to get that ventilator. New York City physician, March 2020. Refrigerated trucks were parked outside hospital loading docks, not to deliver supplies to store the dead. The iconic Javits Center Convention Hall was converted into a field hospital. The Navy dispatched the USNS Comfort, a 70,000-ton hospital ship, to New York Harbor. It was a powerful image. It was also, in many ways, a symbol of how badly the country had been caught off guard. You don't send a naval hospital ship to an American city unless something has gone catastrophically wrong. By the end of March, the United States had more confirmed COVID-19 cases than any other country on Earth. By April of 2020, More than 22 million Americans had filed for unemployment. The CARES Act passed Congress with rare bipartisan support, a $2 trillion emergency rescue of an economy in freefall. Economic impact payments began landing in Americans' bank accounts for the first time in history. And yet, something strange was happening alongside the grief and the lockdowns. A fracture, quiet at first, then deafening, was opening in American society. In late April, governors in states like Georgia began reopening gyms, barbershops, and tattoo parlors before federal health guidelines recommended it. The White House sent mixed signals. The president publicly questioned the value of masks, even as the CDC was urging all Americans to wear them. I just don't want to be wearing a mask as I greet presidents, prime ministers, dictators, kings, queens. Somehow, I don't see it for myself. President Donald Trump, April 3, 2020. A piece of cloth, a simple public health measure with centuries of medical precedent. In 2020 America, it became a political identity. But beneath the culture wars, a more fundamental question was forming, one that scientists, intelligence agencies, and foreign policy experts are still fighting over today. Where did this virus actually come from? The two leading theories have never been reconciled. The first, a natural spillover from an infected animal at or near the Wuhan seafood market in Wuhan. The second, an accidental leak from the Wuhan Institute of Virology, one of the world's leading coronavirus research facilities, located just miles from the market. In 2023, the U.S. Department of Energy concluded, with low confidence, that COVID-19 most likely originated from a laboratory incident. The FBI reached the same conclusion with moderate confidence. The CIA, the CDC, and the National Intelligence Council have not agreed. The U.S. government, to this day, cannot reach a consensus on how this pandemic began, and China has never allowed a full, independent international investigation. The American people lost nearly 1 million of their fellow citizens. They deserve an answer. They have not received one. The world that didn't come back. In the spring of 2021, the United States launched the most ambitious mass vaccination campaign in its history. Stadiums converted to inoculation sites. Pharmacies open around the clock. The federal government shipping doses to every corner of the country. By May, the CDC announced that fully vaccinated Americans could remove their masks in most settings. It felt like a return. It felt like the end of something. It wasn't. Because what the numbers never fully captured, what the daily briefings and the infection rate charts and the variant updates could never quite convey, was the weight of what had been lost. Not just lives, though nearly 1 million American lives is a number too large for the human mind to hold, but also the 1,000 small losses that don't make it onto a casualty list, 100,000 small businesses that closed permanently, the restaurants that turned off their lights, the family-owned stores that had survived recessions, wars, and decades of change, and couldn't survive this. An entire generation of school children who spent a formative year learning in isolation, staring at screens, losing something that experts are still struggling to measure. And the American healthcare system itself, which entered the pandemic already strained and emerged from it fundamentally changed, still struggling with staffing shortages and burnout years later. It is a devastating loss of life. It is devastating to families, economically, emotionally, spiritually. It's sort of a once-a-century phenomenon, and frankly, I really hope it doesn't come back for another century. Dr. Anthony Fauci, Director, NIAID. The pandemic reshaped America in ways we are still measuring. Remote work, which employers had resisted for decades, became overnight proof that much of the country could do its job from a kitchen table. By 2022, the 5-day office week was a relic. The hybrid model had arrived, and it wasn't leaving. The relationship between Americans and their institutions, the CDC, the FDA, the White House, the media, had been tested and found wanting by millions of people on every side of the political divide. Trust, once broken, is slow to rebuild. And then there is the question that will define the reckoning still to come. Could this have been prevented? Not the virus itself, perhaps not, but the scale of American suffering, the speed of the collapse, the testing failure that left the country blind for critical weeks. The PPE shortages that forced nurses to reuse protective equipment designed for single use, the nursing home deaths that accounted for a devastating share of early fatalities. A virus emerged from somewhere, a market or a lab, or the space between both theories where the truth may still be hiding. It moved through a system of governance and public health infrastructure that by every measure was supposed to be the best prepared in the world. The United States ranked first on the Global Health Security Index before the pandemic began, and then it ranked first in something else entirely. COVID-19 is not over. It has not ended. It has become endemic, a permanent feature of the biological landscape, a virus that will mutate and return season after season for the rest of our lives. The acute emergency of 2020 and 2021 has faded into a chronic condition, managed with annual boosters and monitored in hospital admissions data that most people no longer check. But the story of how it began and how America responded is not a closed chapter. It is a case study in the cost of institutional failure, in the price of political cowardice, in what happens when a system built on the assumption of competence encounters a problem that demands more than assumption. The pandemic may be over. The reckoning is not. Between February and May 2020, approximately 200,000 Americans died. Later studies suggested that with earlier action, a significant portion of those deaths may have been preventable. In the summer of 2021, airports that had been cities of ghosts filled with people again. Scientists called it revenge travel, humanity taking revenge on the pandemic for lost time. Every journey became a small act of resistance. Autumn 2021. Schools reopened across the world. For the children, it was simply a return to school. For their teachers, a return to meaning. By 2026, COVID-19 had ceased to be an emergency and had become part of the human landscape. Like seasonal flu, only more complex, more insidious, and with a longer memory. The COVID-19 pandemic took more than 1 million Americans, more than 7 million people worldwide. It broke economies, education systems, families, and dreams. It changed the way we work, the way we meet, the way we breathe. But it did not change what matters most: our need for one another, our capacity to care for strangers, our insistence on living, even when living seems impossible. This is a film about a virus. But more than that, it is a film about us. While millions of people around the world waited for salvation, hundreds of scientists across the planet were simultaneously racing against time. Vaccines that once took decades to develop now needed to be created in months. Science did the impossible. 2020 revealed that the pandemic was not only a medical crisis, it tore open old wounds of inequality, injustice, and fear. Those who could afford to work from home and those who had to go out every day, these were two different worlds colliding. Millions of people like Jason had no luxury of quarantine. Bus drivers, supermarket cashiers, delivery workers, healthcare staff, cleaners. They went out every day to face the virus so that others could stay home. They were called essential workers, but they were paid the least. More than 1 million Americans, more than 7 million worldwide. Numbers the mind cannot fully hold, but each number is a person someone loved, who had breakfast in the morning, had plans for the weekend, knew a song by heart. Dr. Li Wenliang, Wuhan, 2019. They came to my door. They made me sign a paper saying I had been spreading rumors. I should never have stayed silent. Died of COVID-19. February 7, 2020. History remembers those who listen. Subscribe to Dark History Archives and uncover the stories that were never meant to be told.